Hello to you, and thanks for being with us today for Spotlight Carolina. I'm Mark Cady. If you suffer from sinus problems, a minimally invasive in-office procedure at Mountain Ear, Nose, and Throat Associates may be the key you're looking for to find some relief. Dr. Shawn Kosnik joins us today from Mountain Ear, Nose, and Throat Associates. Welcome, Dr. Kosnik.
Thank you, Mark. It's good to be here.
Let's talk about this procedure, because this procedure is helping a lot of people all across Western North Carolina. They're coming to your office. Why should people who suffer from sinus problems drop what they're doing right now and really listen to what we're about to talk about with this procedure?
This procedure is very exciting. It's a wonderful thing to offer to patients. Perhaps patients who require antibiotics or are on daily medications to help prevent symptoms, they could benefit greatly or potentially from this procedure. Also, patients who have a family member or a friend who had a sinus procedure maybe a decade or so ago when it was done in a traditional sense, they could benefit from this procedure, not have to go through the significant pain or the long recovery or even packing that's required a lot of times with a traditional sinus surgery. So this is much more elegant in that regard. And I can tell you personally, having had some family members go through this, that symptoms can be improved almost immediately, and that the recovery really is just a few days so they can return to normal activities.
Well, tell us a little bit more about this procedure, because minimally invasive and in-office are two big things, because as you talked about, a few years ago, it was a lot more involved with trying to do a procedure.
Yes, so this procedure uses a balloon device that's inserted into the normal openings of the sinuses, and it's dilated and it opens that drainage port for the sinuses so that the infections and the symptoms of chronic drainage don't occur as frequently. So patients perhaps can use medications less, or they don't have to go to the physician's office to be seen in an acute setting nearly as often for their symptoms that occur.
And this sounds, because it's in office and it's minimally invasive, sounds a lot more cost effective. Is that correct?
It is more cost effective for a number of reasons, one of which is that insurance companies tend to cover this very well. So patients, when they come to see us, have a lot fewer out-of-pocket expenses. There's less co-insurance pays. Also, I think if a patient goes through this procedure, if they're a good candidate, they have less of a need for chronic medications, so there's a cost savings there. And perhaps time off work is much less, so they're not having to take time off.
You kind of alluded to that a little bit. Recovery time is a little bit easier with this, obviously, right?
It is. There's two main reasons, I think, for that, Mark. One is that we're using a different type of anesthesia. It's topical anesthesia, not general anesthesia.
That's a big help.
It is a big help. And
for people who are interested in this procedure, do they need a referral from their physician to come and have this procedure?
Almost all patients don't need a referral. We have a highly trained staff that don't know all the nuances of the insurances. They can figure that out.
If you suffer from sinus problems, this may be the procedure that finds you relief. MountainENT.com. You can call 828-586-7474. Check out that website, learn more, and people are headed to these offices all the time to take advantage of this procedure. Dr. Kosnik, thanks for being with us today.
Thank you, Mark.
Thank you for being with us here today on Spotlight Carolina. I'm Mark Cady. Until next time, take care.